Good morning. Again, my name is Dexter Dai from OrthoSport Hawaii. OrthoSport Hawaii is a locally owned and operated physical therapy clinic with 3 locations that service Kaka'ako, downtown, and New Valley. And I'm one of the physical therapists there. So let's start. Aging, the human aging process is universal, ubiquitous, and inevitable. Every physiological function is continuously being diminished. So it's happening to all of us. We feel it. Usually every day we feel that. And today I'm going to talk to you about the benefits of exercise and how PT can help us with that. So the effects of aging here. So aging can result in a decline in muscle function, cardiorespiratory fitness, balance, power, and physical activity. And all those things can lead us to being at an increased risk of falls or injuries, or even the fear of falling or the fear of injury. That can result us into being a little bit more fearful of moving and being doing our everyday activities here. And with less movement, we have an increased decline in some of these functions that we described here. So with exercise, we don't stop moving because we grow old, but we grow old because we stop moving. So what that means is, our bodies are designed for movement. We need to move. There's a lot of functions in our body that are facilitated through movement. Us sitting here for an extended period of time, gets a little uncomfortable after a while. After probably towards the end of this lecture, you might feel a little antsy. You might feel like you need to sit up a little taller and stretch out. Your legs might feel a little restless, and those are all signs that, probably we need to get up and start moving. So throughout this lecture here, I'm going to have you get up and perform a couple of simple activities to kind of encourage that movement with us, because we need to move. And today I'm going to talk to you about ways that we can do that with exercise. So some of the benefits of exercise. It improves frailty. We can improve our body mass, our strength, our mobility, our balance, our physical activity level, our energy, our cardiorespiratory fitness, and muscle function. So these are all ways that exercise can help with our physiological functions. In addition to that, there's psychological benefits as well. We have improved mental health and cognition with exercise. And then in addition to that, with exercise, that can improve our overall quality of life. It's going to allow us to enjoy the things that we want to enjoy. It's going to improve our capacity for daily activities. We're going to be able to do things for as long as we'd like, or a little longer than we're used to. That's going to allow us to be a little bit more independent with our activities, not have to ask for help or use assistance. And overall, that can help with a reduction in overall mortality as well. So we exercise for life. And exercise is medicine. More and more research is showing that exercise can be very beneficial for things like chronic diseases, chronic conditions and diseases, from anything from prevention of these chronic diseases and conditions to risk reduction and treatment. So this is a list of some of those chronic conditions and diseases that research has shown to improve. So if we look at this list here with Parkinson's disease, exercise, a certain amount of exercise can help with reducing the risk of Parkinson's disease. And it can also improve some of the motor and non-motor symptoms of Parkinson's. When we look at Alzheimer's, there's been evidence to show that in the early stages of Alzheimer's, it can slow the cognitive decline of Alzheimer's. Dementia, exercise can help with cerebral vascular function, cognition, and neuroplasticity. And in depression, exercise can help with your mood and reducing psychomotor retardation here. So when we look at exercise as medicine, it's a whole body approach. It's directed at several physiological systems simultaneously, and it's cost effective. It can be free or cost little to nothing to exercise, and it's non-pharmacological. It's not another pill that you have to take. So one of the things that we offer at OrthoSport is something we call Brain Fit. And that's something specifically that we implement and use to treat issues with improving your cognition here. So exercise can help with that. And there's evidence that shows there's a certain amount of exercise if we participate in these activities on a weekly basis here that we can really show some relevant changes, clinically relevant changes in cognition. So this specific piece of evidence, research shows that resistance exercise is best when we're comparing it with cardiovascular exercise. And some of the general recommendations they make is, walking 40 minutes a day, 5 times a week can be helpful. And doing resistance training 45 minutes, 5 times a week can be effective in improving your cognition. So that might sound like a lot for some people, and you might not know how to start something like that. And that's where physical therapy can come in. We can kind of look at kind of what your situation is, kind of your baseline physical abilities, and then make some recommendations and make a plan to get you to something like this. So these are the things that we have to kind of battle against aging here. So when we look at some of the things that physical therapists would look at, we're looking at 2 things in regards to movement here. What's your overall physical activity level? Like what are your daily activities? What are your basic habits that you're already currently doing? Do you tend to take the stairs more than you take the elevator? Are you a little bit more active around the house, a little bit more independent where overall you're moving a little bit more? So that's kind of your physical activity level. And then we look at structured exercise, and that's where physical therapy comes in as well. So a structured exercise can look like a physical therapy plan that a physical therapist works on you with. Maybe you have some shoulder pain, and a physical therapist can work on building you a program with resistance training to help you with your shoulder pain. Or that can look like an aerobic or a resistance program that a personal trainer sets you up with, or maybe some recommendations that your doctors has given you to with a purpose and a plan to improve a certain activity that you have limitations with. So why don't we start with a little bit of an exercise here, or a quick little test here. So we can all stay seated with this one here, but let's take a look at a movement that we all do on a daily basis. Let's look at our shoulders here. So let's have everybody, if you feel comfortable, you can set your paperwork down for a second here, and then we're just going to have you move your arms a little bit here. So just kind of follow along with me, and let's kind of get a feel for how our bodies are moving right now. So without kind of hitting anybody with your arms here, we're just going to have you raise your arms out to the side and up and overhead. So I want you to get an idea of how that feels. Does it feel tight? Is there some pain? Do you feel a little limited? Is there anything going on here that doesn't feel good? And then let's go ahead and bring it down here. So now, let's get an idea of how that feels. Did it hurt for anybody? Did it feel like you couldn't reach as far as you'd like? Ideally, we want to be able to bring our shoulders all the way up to where our bicep touches our ear. And if you're not able to do that, maybe there's something that we can do about that. So let's see if there's something that we can do about that right now. So as physical therapists, we can assess the safety of the motion here. Maybe there's something going on that could be causing a little limitation here that we can do something about. Or maybe there's a simple modification that we can do to help with that. So why don't we do this here? I know a lot of us tend to, slouch a little bit as we get tired. Maybe our postures from working or being on the computer for so many years has caused us to be a little bit more rounded here. So why don't we do that same motion here? But I want you to sit nice and tall. I want you to turn your palms and face them towards me. So you'll notice that when you turn your palms forward towards me here, it kind of sets your shoulders back a little bit here. So it makes you sit up a little taller. And when you do that, you'll feel the muscles in the back of the shoulders working a little harder. And then now I want you to do that same motions with the palms facing forward. Reach your arms over to the side and see if we can get a little further with that. And then back down here. So oftentimes if you set your shoulders back and you engage your shoulder blades a little bit more, that'll give you a little bit more motion here. Maybe it feels a little freer. Maybe it feels a little looser to kind of go up and over here. And we compare that to when we're kind of more rounded forward with our palms down, with our shoulders more rounded, maybe a little bit more slouched. That's a little bit more limiting here. So Physical therapists can help to kind of assess if that's a limitation that you might have. So if that does feel better for you when you turn the palms forward and set your shoulders back, maybe that could be an exercise that we integrate into your program. So what that can look like is some shoulder blade setting exercises. We call it scapular retractions here. Maybe we're constantly rounded forward and we need to work on building up some of those muscles that get us up a little taller. And if that's going to improve the way we move, then let's integrate it into our regular exercise program that we do. So that's how physical therapy can help with certain physical activities. When we look at structured exercise, that's where a physical therapist can come in and see, maybe you can't go all the way up because it's not as simple as setting those shoulder blades back. Maybe there's some limitations there. Maybe there's some tightness in the shoulder that we need to work on some stretching. Maybe a physical therapist needs to come in and do some stretching for your shoulder for you to kind of regain that motion. Maybe you've had a previous injury, maybe frozen shoulder history that we need to work on building some of that range of motion first before you can do that on your own. So a physical therapist can assess those limitations, develop a plan of care. Let's start with some stretching. A physical therapist can help you with that movement and then progress you to ways that you can stretch that out yourself. And then you can start strengthening yourself, and then you can return back to those normal movements on your own. So we create goals, we modify as needed, and we progress you along to get you back to moving normally. So as physical therapists, we're movement specialists. We're not very public speakers, but we're movement specialists, and that's something that we do well. And so we improve the way you move. So the way we do that is we diagnose and we treat movement limitations. So if you have a difficult time moving, whether that be with your shoulder or with your back or with a certain activity, maybe you want to be able to pick up that big bag of rice again. We can look at that and see what the issue is with that. Maybe there's some issues with tightness or weakness or balance, or maybe we just need to modify your form a little bit. Physical therapists can look at that and prescribe you some exercises. So with the shoulder, if you're used to lifting a certain way and causing pain, we would prescribe you exercises where you correct that position of the shoulder, practice that movement in a pain-free way, and then as you practice that movement more, the next time you go and you grab that mango here, you're going to have a better position and more ability to do that. So with exercise, we do hands-on care, stretching, guiding you through exercises. And then we educate you on what's going on here. So if there's a limitation that you have and you're not sure what's going on, sometimes that can be fairly limiting. Do I keep pushing it? Do I not? Maybe I should just avoid it. And sometimes that just avoiding things isn't really the answer here. Maybe there's a way to modify that motion to improve it so that you can continue to move because movement helps with life. So one of the things we see frequently in the clinic is people coming in after a fall. So falls. The loss of balance is a fact of life as we get older. That's false. That's a myth. So we don't have to lose our balance as we get older. We can do something about it here. So the fact is we lose flexibility and strength and balance mostly due to inactivity. We don't use those faculties as much anymore, and if we don't use it, we lose it here. Maybe we haven't really challenged our balance much. Maybe we haven't really worked on that flexibility and that strength much. And if we're not as active and we're not challenging those things, we start to lose that ability to do so. And maybe there's some fear. Maybe you're not sure how to start. And that's where physical therapists can come in to help with that. Because falls are a leading cause of injury in older adults. A third to half of all people 65 years and older have had a fall, have experienced a fall, and half of those are repeated. You fall once and you fall again because nothing's really changed. Maybe your balance hasn't improved. Maybe your range of motion, your strength, nothing's really changed. So if nothing's really changed in the way that you're moving, the same results are likely to happen here. So, and of those falls, 5% lead to broken bones, and 200,000 of those annually lead to hip fractures there. And all that's to say, when we fall, we become limited because our body needs to heal, and we might not be able to engage in those same activities that we did before. And with decreased activity, that's going to increase, the likelihood of a fall, and it kind of creates a vicious cycle there. So, and with less activity, we get all those kind of declines in physiological and psychological kind of faculties as well. So, we got to address it if there is a risk of falls to you or your loved ones here. So, let's see here. So we're going to do a quick fall assessment, a fall risk assessment here. So if anybody who wants to participate, we can just set our books down here, and all we need is just a chair, some cleared space where you feel comfortable sitting and standing here. And so what's going to happen is I'm going to assess, I'm going to do a 30-second chair stand test. So we're going to sit on our chairs here, make sure our feet are set. And then I'm going to set the timer for 30 seconds, and I want you guys to count how many times you can do this in 30 seconds here. So first of all, I want to make sure you guys are safe. We're not going to use our arms to push off, because this is going to assess our leg strength, our leg endurance, and then overall give us an idea of, what is our fall risk here. So when everybody is ready, I'm going to set my timer for 30 seconds here. When I say go, you're going to stand up and sit down as many times as you can in the next 30 seconds here. So when everybody is ready, and whatever you're comfortable doing here, it's not a race. We're not trying to beat any records here, but we just want to get an idea of where you're at here. All right, so when everybody is ready, I'm going to set the timer, and then when I say go, you guys are going to start standing here and sitting down and standing. Okay, ready, set, and go. So we got 30 seconds here. Keep going up and down as many times as you can. We got 25 more seconds here, and I want you guys to count yourself here. 20 seconds. Nice and smooth. Some people are moving quicker than others, so good. We got about 10 more seconds here. Good job, not using your arms. And in about 5 more seconds here. 3, 2, and 1. All right, good. So you have that number in your head. Maybe a little tired. Maybe you felt that a little bit in certain areas that you forgot that you had. So we'll talk a little bit about that here. So everybody has that number. Who got more than 10? Good. Who got more than 12? Good. Still a lot of hands up. Who got more than 15? Good. Fewer and fewer hands up. Good. Good. So let's take a look at what that looks like here. So this is based on research here. So it's going to be based on your gender. It's going to be based on your age here. But anything lower than this number here puts you at a higher risk of falls. So this is just kind of a general assessment here to see, where your risk is. If it's higher than that, then great. But if your knees felt a little sore when you did that, maybe there could be something that we can do about that, so that knee soreness or pain doesn't lead us to not wanting to sit and stand as much here. So if that number is a little lower than you like, then you might want to talk to your doctor about what can be going on there. So let's talk about why don't I give you some more physical therapy recommendations, since we just did that sit to stand here. So if everybody, whoever wants to stand up, go ahead and stand up for me. And I'm going to use this chair over here to just use as an example. So let's say we just sat, we're squatting down, not quite to sit down all the way here, but I want you to just squat down about halfway and get an idea of where you feel that. Where do you feel that pressure? Where do you feel that load? Do you feel it in the knees? Yeah, and now stand up all the way here. So, knees aren't really something that we want to stress too much here. You stress your knees, they don't really get stronger when you stress them. There's cartilage, there's a kneecap, there's a meniscus, stuff there that, usually when we hear those things, it's really not a good thing here. But if we stress our muscles, if we stress the thighs over here, that's a good thing. We stress muscles and they get stronger, thankfully, right? So let's give that a try, and let's make some little modifications here. So just go and watch me for a second. If I squat down this way here and I bring my knees forward, I'm going to likely feel a little bit more stress in my knees. But if I shift that weight backwards a little bit, I'm going to feel that weight shift from my knees a little bit more into my thighs. So are you able to find that point where you feel more of that pressure in your thighs? So that might be a little bit more tiring because maybe those muscles aren't very strong. But if we stress those muscles here, it's going to be a little less painful kind of in our joints. And joints are what we want to protect because, you know, some of us might have joints that we've replaced before because of too much stress in those joints. But little modifications like that can help. So just shifting your load into different areas. This is going to be more knee stress. You shift back a little bit, you're going to feel it more in your thighs. So we can work that and turn that into an exercise. If we shift back a little further, maybe we feel it in the back of the legs, into the hamstrings here. So those are all, you know, ways that we can kind of modify very simple motion to stress areas to improve our strength, improve our balance, and yeah. Oh, you guys can sit down now. Yeah. So I'll go over another fall risk assessment here that we use in the clinic as well. We won't do this one here, but I'll just kind of talk you guys through it if you guys are interested in testing it out yourself or on a loved one here. But this is something usually we'd recommend a physical therapist kind of walk you through because sometimes there can be some safety issues as well. But this is a timed up and go test, and that's going to assess your mobility. And what that looks like is you set up a chair, and then 10 feet away, you set a cone, and you set a timer here. So whenever the person starts sitting down, you have them stand up, walk down 10 feet, turn around from that cone, come back and sit down here. So it's just a really simple kind of mobility test that we can do, and anything less than 12 seconds, you know, puts a person at risk of falling here. So if a person has, anything longer than 12 seconds will put a person at risk of falling here. And that's something probably we do on a regular basis here. You know, somebody rings the doorbell and you have to run over there to, you know, answer the door or phone or whatever that might be, or, you know, turn off the stove. And if we can't do that in a certain amount of time, then, you know, it could put us at a risk of falling here because maybe there's some balance issues, maybe there's some range of motion issues, strength issues that we need to address here. All right. Just some quick things on falls. You know, how do I decrease my risk of falling here? So we talked about strength. Maybe we need to work on some squat exercises so that, you know, when you get up, you're not feeling stress in your knees, and maybe that pain slowing you down from getting to that door quickly enough. Maybe there's some mobility issues. Maybe there's some flexibility that we need to work on. Maybe there's some balance issues, power issues here. Maybe there's just some activities in your everyday life that are putting you more at risk of falling. Maybe you know, we're engaging activities in the yard that, you know, maybe just isn't as level as it should be, and that could just put a little bit more stress through your body than is safe at this moment here. We also, at physical therapists, also look at living conditions here. You know, how is your living situation? Are there some things that maybe you're overlooking? Maybe there's some more obstacles in your home than you like. Throw rugs, cords, narrow spaces. You know, so those are all things that physical therapists can kind of assist you with in improving your living condition to overall improve your quality of life with decreasing your risk of falls here. So we'll talk a little bit about balance next here. So with balance, you know, our bodies use 3 systems for balance here. We use our visual system, our vestibular system, and then proprioception is another thing that we use to kind of help us with our balance. Any limitation in any of those systems can lead us to not having the best balance that we'd like here. So let's break that down here. So for visual, you know, we use our eyes to kind of orient ourselves with the horizon here, you know. So if our eyesight isn't great, maybe we haven't been to the optometrist in a while, maybe we need a little adjustment with our glasses here because things aren't as clear as we'd like, you know, that can lead us to being more at risk of falls. Poor lighting can be an issue as well. So maybe we know somebody, or we've experienced a little bit more of a loss of balance or a fall in the evenings when we get up in the middle of the night to do our thing, and maybe the lighting isn't as great here. So those are some things that we need to be considerate of too. And obstacles, of course, you know, we want to kind of limit those factors as well. So the other system that we use is our vestibular system, like inner ear, that also helps with balance as well. So issues affecting our inner ear can lead us to maybe feeling a little dizzy, maybe feel like the room is spinning when we get up too quickly, and that can lead to an increased risk of falls. So a little known thing that not a lot of people know, that physical therapists can also help with vestibular issues. So if you've ever gotten up quickly or turned your head quickly and noticed that not only are you dizzy, but maybe the room is spinning. Specifically, that room spinning here can be an indication of maybe some vestibular issues like vertigo that a physical therapist can help with as well. And then proprioception. Proprioception is kind of our ability to kind of feel the ground, feel our surroundings here. So like our little nerve endings in our feet telling us where we are in space. Are we shifted a little bit more forward into our toes, or maybe a little bit more back into our heels? So issues with that can kind of affect our balance if we don't have good sensation. Or maybe the strength and balance issues can lead to an issue with more falls here. And nerve issues can be something that physical therapists address as well. So earlier we talked about vestibular rehab. So that's something that physical therapists can assess and treat as well if it's an issue with what's causing your balance issue here. And usually, again, it's like a room is spinning kind of sensation that you might be getting. There could be some issues with the inner ear that physical therapists can work on positioning your head and doing certain exercises to address that. And then there's exercises that involve kind of how your eye and your brain kind of function together. So doing certain eye movement control exercises that can help with balance as well with vestibular issues. And then, of course, working on balance training, stretching and strengthening as well. So with balance training, physical therapists will usually assess, where the issue is with balance. Maybe your balance issue is when you're in sitting. Maybe and when you're sitting without any support here, there's some issues with being able to maintain that and feel safe. Maybe it's an issue with standing, balancing on one leg. Maybe it's an issue with balance with going up the stairs here. So physical therapists will take a look at that and assess where that issue comes from and ways to kind of address that here. So we'll usually develop a plan and then work on improving strength, stability, and movement as well. Other things we look at for reducing fall risk is we can make recommendations to make modifications to the home. Maybe we need to install some railings for the steps going into the home. Maybe we need to kind of clear up some space so there's no obstacles and potential things that can get in our way when we're trying to move quickly. Maybe we need to stop wearing those slippers because they keep getting caught on a step or so. So those are things that we can look at as well. And then we use that to educate the patient, the caregivers, the family. And sometimes PTs can catch things that we're not aware of. Sometimes working with family can be, I know for myself, working with my grandma, sometimes even being a physical therapist myself here, sometimes I overlook things because I care so much about my grandma that, I forget about simple things that we can make modifications to it. So physical therapists can come in and take a look at those things too. We can instruct you on keeping your body in shape, on regular exercise, and what that looks like with exercise, how physical therapists can help with that is we can prescribe exercises for you, a structured exercise program, and that's going to be based on whatever your needs are. So there's always those general recommendations that you can find and that people can give you here, but if there's a specific limitation that you might have, whether that be with like a knee issue or a shoulder issue or a back issue, we can individualize a program to kind of assist you with getting you back to moving normally again. And then we can adjust it and control it just like any other medical treatment. We can make modifications to that. And then it's important to kind of look at, how we do those exercises, what kind of equipment we have around the house, and like the volume of how much we do. Sometimes, we don't do enough to actually stimulate a response from the body. If you don't challenge yourself enough, sometimes your body doesn't respond and react and improve those strength limitations or those balance issues or those range of motion limitations here. So We try to program in things where we can challenge you a little bit. And in a safe environment here, if you're working with the physical therapist here, we can monitor and make sure that things are safe while you're performing those activities here. And then we can adjust the volume and intensity accordingly from there. Let's go into another movement here that you guys can kind of go take away with you here. So let's look at bending here. You know, when we have to bend down to pick up our bag, bend down to put on our shoes here. So if everybody feels comfortable, I'll go ahead and have you stand up for me again. And then I'm gonna take a look at bending with you guys to see if there's something that we can do to kind of help you with that and let you take home some modifications and adjustments today here. So it might not have a lot of space in front of you here, but let's go ahead and bend down and see if you can reach towards your toes. Whatever you feel safe doing here. So at the bottom here, I want you to get an idea. Where did you feel that? Okay, you guys can come back up now. Good job. Yeah, some of you guys were tickling those toes pretty well, so that's pretty impressive here. But where did you feel it? Did you feel it in your backs? Did you feel it in your legs? Did you feel it in your knees? Maybe there was a little pain. Maybe you haven't gone that far in a little while, and you're surprised you were able to do that. But so when you bend down here, did any of us have any back pain or tightness or stress there? How many of us felt it in our legs? Great. Yeah, so what can we do about it if we feel it in our backs? You know, if we feel that stress in the same areas of our back that we've had pain before, maybe it wasn't painful. Maybe it was just a little stress or pressure in that back. But maybe it was in the same area that you've had some pain before. Maybe if we continue doing that, it could be a little bit bothersome. It can kind of wake up those things again. But what if we make some modifications to that to improve the way we move? So what that can look like is, so when we bend, we're using a couple things. We're using our backs, we're using our hips, we're using our knees. So depending on how you bend, that's going to determine where that stress is going to go. So I'm going to walk over here. And show you guys. So when we bend, our back is bending, our hips are bending. Could be a little bend in the knees here. So depending on where we bend first, that's going to determine where that stress is going to go. So if I bend from my back first, maybe that's why I feel it in my back, because that's the first thing that moves. That's the first thing that gets loaded. But maybe let's sequence that a little differently here. Maybe when we bend, let's keep our back a little straighter and then bend from the hips first. So what that looks like is I'm just going to push my hips back and move first from my hips. And then as I bend here, maybe I feel a little bit more on my legs first. And then once those legs kind of max out, then I'm going to go down with my back second here. So it's just the way that we sequence it. We're going to end up in the same location at the bottom there, but maybe if we use our hips first, that'll allow us a little bit more ability to use these muscles that we have down here before that back kicks in. Because we tend to overuse that back already here. So if we can limit that and adjust the way that we move to just make that a little easier, that can make just movement and activity a little easier overall here. So we turn that into an exercise. Doing a little bit of a deadlift motion here where we practice just hinging at the hips before the back moves. Or maybe the issue is, so we want to make sure that you feel it in the legs and practice that movement. So the next time we do have to bend down, we don't default to using our backs again. Right? So it's just making those little modifications, practicing it so that the next time we do move, we do it in a better way. Or maybe the issue is, we have a little bit of a harder time back straight. So what that can look like is we can kind of review that previous exercise we did for the shoulders. We pulled the shoulders back to kind of improve our overall mobility overhead, but that can also help with the back as well. So maybe we're always a little bit more hunched forward, but if we pull the shoulders back, that's going to keep our back straighter. And if that keeps our back straighter, when we bend, we're more likely to keep that back out of it use more of the legs before that back kicks in. So.
Stand up. You just stand up?
When you stand up here, so depending on how you first initiate that movement, that's going to determine how we stand up. First, we want to make sure that you can get down into that position comfortably first before we stand up. Usually, if you're already bent forward, your back is already loaded. So some of us were feeling that earlier here. And if we tried to modify that. It's hard to kind of engage those legs as we stand back up because you're already in that position, you're already loaded in those areas, like the back here. So when we first bend here, we want to try to use those legs first. If we initiate with the legs, we're more likely to use the legs as we stand back up here. So I'm going to move back over here. So when we bend, we want to, where we move here, where we start the movement here is usually where most of that stress is going to go. So if we initiate from the back, we're loading that back, and when we get up, we're likely to load that back again as we get up here. So a little bit more stress in the back. But if we load from the hips, we're able to use those hips first, and then you're more likely to use those hips to kind of get back up here. Yeah. So. All right. So. I think we have a question and answer session a little bit after this here, but I'll just finish up here. So other options of ways to improve, your exercise and your overall activity level. There's maintenance programs that physical therapists and health professionals can kind of help you with. And there's services, maybe you can't go to an outpatient physical therapy clinic like OrthoSport has. There's home services as well that a doctor can recommend. So a physical therapist can go to your home and help you with you or your loved ones if you don't feel comfortable going to a clinic on your own, or if you don't have those transportation abilities here. And there's options beyond physical therapy as well with that here. So there's different services that are available to kind of help you to move better, because the more we move, the more we can live, and it's just going to help with our overall quality of life here. So these are just some general exercises, but again, we like to design exercises depending on each individual's needs here. So there's always general exercises, but if some of these exercises kind of helped you with improving the way that your shoulder moves or squatting or with bending here, practice those exercises and try to change the way that you move. Because if we keep doing the same things and keep dealing with that same discomfort and pain here, not much is likely to change. But these little quick corrections that we just did in here, that can help us to continue to move and be as active as possible. And that's ultimately the goal of exercise. I don't exercise just for the fun of it. I exercise so that I can continue doing the things that I want to do for as long as possible here. Yeah, so that's it.
Dexter, thank you so much for that very practical information, and I certainly could feel it when I was doing some of those things. So I guess I need to exercise more, right? All of us need to do that. Are there any questions? Okay, lots of questions.
Will you please talk about what insurance will cover?
So all insurances that I know of will cover physical therapy. So basically, insurances are going to cover what's based on medical necessity. So if what that looks like is if you have an inability to move and live your life, your everyday activities if you're not able to kind of move in your everyday life and with everyday activities here, it's likely that you need physical therapy. What it doesn't cover, though, is maybe you do everyday things okay, but you want to improve with running or hiking or pickleball. That's where physical therapy might not be medically necessary. But if let's say you injure yourself playing pickleball and now bending down or walking is a little bit more difficult, that's where physical therapy can come in. And that's where insurances will cover. So it has to be kind of everyday life stuff and not just strictly recreational stuff.
Any more questions?
Thank you for your presentation. I have two questions.
Sure.
The first question is in regard to what I call Rice Krispies. Rice Krispies is when at a certain age, at mine it was 73, all of a sudden when you do certain movements like happened today, you feel snap, crackle, pop. So, number one, is that a sign to stop? Or number two, is that a sign to make some changes?
Yeah,
Okay.
that's a great question.
That's only the first question. I'll have another one.
That's the first one, okay. Yeah, so that's a great question here. I mean, we probably all experience a little bit of that with our knees or our shoulders, and I have that too. My issue in my left knee was from a previous injury. So when I squat here, I have to be a little bit more aware of what I'm doing here. So the snaps, the crackles, the pops, that's not necessarily a bad thing here. It could be some tightness, it could be some scar tissue from a previous injury, but the main thing that we're looking at is, what are you feeling when you do that? If you're squatting down and you feel cracking and popping in your knees and it's painful and you feel stress in the knees, maybe there's something that we can do about that. We might not necessarily be able to kind of get rid of that because some of that could be from, arthritis, some changes that you've already had in the knees, a history of issues in the knees here. But if we can kind of change how you move by shifting those hips back and feeling it more in the thighs, then that load isn't going to stress that knee and cause that cracking and popping and to maybe potentially worsen. But if we can shift that stress to the thighs, then that's safe. We feel the stress in the thighs. We don't feel that pain and pressure in the knees, and that's something that is going to be. That's going to require a little bit of education on here. That's frequently what I do with my patients that come into the clinic. I assess, I help them to gain understanding of what's going on with their knees here. Is it necessarily a bad thing that it cracks and pops? No, but if it's painful, if it's sharp, if it's aggravating, okay, then that's kind of a good reason to stop. But if there's ways to modify it to reduce that pain, eliminate that pain, and reduce that cracking, we can frequently do that as well. An exercise that I like to do in physical therapy is just a basic row exercise. The same thing that we did earlier was positioning the shoulders back. Frequently, I have people do that exercise, and it probably looks like this. And as they do it, they'll get some popping and cracking in the shoulder here. And a simple adjustment of just being able to pull the shoulders down and back a little bit will eliminate that cracking and popping in the shoulder. Because when they're in this rounded position, maybe that position's been overused, and there's a little bit of scar tissue in that area. Let's say it's been worn a little bit here. So every time they move here, there's a little bit of rubbing. But if we correct that position into kind of a more natural and open position here, that motion is a little freer, and that can reduce some of that cracking as well, and popping and snapping here. But everybody's a little different, so yeah.
Second question, we're lucky to have experts like you, but you have to get your training on the mainland. And so that contributes to a PT shortage in Hawaii. I understand HPU is starting a program. When will these local folks be trained and be able to start servicing the community for physical therapy?
Yeah, HBU is a little over a year into their inaugural program. So the first cohort has already gone through a year of training, and the second cohort just started. So we'll start to see some of those physical therapy students kind of practicing very soon. I think February is when the first group of students will start going into the workforce and practicing a little bit here. So what that looks like is, a physical therapist like myself will take a student and kind of walk them through kind of what things look like in the clinic here. So we're very thankful to kind of have that come to the island.
Okay.
Yeah, one of your earlier slides showed a recommendation of resistance training 5 times a week. And I thought it was always recommended that you not do weight training on 2 consecutive days, or at least not do the same muscle groups on 2 consecutive days, but have a rest day in between working with weights. Is that still the recommendation, or?
That depends on a few things here. Where am I? So, like at the bottom of this slide here, it talks about dose response effect here. So it depends on the type of exercise you're doing. So the intensity of the exercise, the volume of the exercise. So, if you're lifting heavy weights, maybe you're going to be a little sore the next day. So you need to take a day or 2 in between to recover from that. But if you're doing just general exercises like getting up from a chair and working on some squats, that's something that we need to be able to do on a regular basis, multiple times a day, every day. So we train it according to that. These are endurance muscles that we want to train, so we're going to train it in that fashion here, where we should be able to do those every day. And maybe if the intensity is a little too much, we can tailor fit that to the person's needs. Maybe 10 squats is something that's going to cause a person to get sore, maybe not so much for the next person, so adjusting that depending on their needs and their goals. So yeah, it depends on the type of activity, if that makes sense. Does that answer your question?
I have a question, Ray. Just furniture. We have nice recliners and watch TV in the evenings. Would you suggest maybe more upright chairs, or that we get up and walk around more during commercials? Is that a problem? Reclining and sitting around for 2 or 3 hours.
Well, there's a lot to that here. So watching TV, I wouldn't consider like exercise. But what we can do with that position here, we can make recommendations on how to improve your posture. Let's say, maybe we feel like we're a little bit more hunched over than we like. And if we're sitting in a really soft, comfy couch, maybe we sink into that a little bit more further later in the evenings here. And that could be contributing to us having a little bit more pain in the back. So if we're doing a lot of this motion here where we're hunched over, we need to kind of address that. Maybe we need to reverse that a little bit and find ways that we can do that. So when you're sitting and watching TV at night, maybe we need to throw a pillow back there, get a little bit more support, work on, reversing that hunched over position by putting ourselves in more of an extended position here. If I ask you to stand while you watch TV, because that's going to keep you a little bit more extended, you're probably not going to do that. But, so exercise is really important to kind of change some of those habits as well, right? Does that answer your question?
Thank you, Dexter, for today. Massage can take as a exercise massage, but therapeutic massage, a spa can consider as a exercise, swimming. I don't know actually.
Yeah. So
you recommend? What your recommendation?
So as physical therapists, we're movement specialists. We want to get you moving better here. So. And sometimes, if we had a lot of stress and our body needs a little bit more time to recover, a spa or massage can kind of help with that. But in order to move better, we got to move. We got to practice those movements here. So where massage and hands-on stuff can kind of help with that is maybe it's really difficult for you to move. Maybe you need some assistance. So a physical therapist can work on some gentle movement with massage, very gentle stuff to kind of get you used to a little bit of stress in that area. And then we can progress that to maybe a little bit more movement, like stretching. Somebody can work on stretching with you. And then as we progress from there, because the goal is to get you moving more independently, then we start showing you exercises to stretch on your own. And then let's add a little bit of weight to that. Now let's work on practicing lifting that luggage overhead so you can travel. So that would be kind of the continuum of, where we could start with something like massage and more relaxation so you can sleep better. And then that's going to assist with, recovery and healing, and then all the way up to, you moving and lifting weights and practicing movements that you want to be able to return back to doing. Yeah.
Dexter, when do muscles go into atrophy?
Oh, say that one more time?
Muscle atrophy?
Uh-huh.
When does that occur?
That can occur as whenever. That can occur with kids. If you don't use it, you lose it essentially here. Our bodies are very efficient. If you don't use a muscle here, there's no reason for your body, or your body's not going to put effort into keeping that strong. So there's been studies that have shown, if you limit, I think they did it with like little bunnies here, but if you limit movement in a joint here, atrophy can happen within a few days. So, but thankfully, movement and exercise and that can stimulate muscle growth to happen just as quickly here too. So, yeah, as quickly as we can lose it, we can kind of regain that as well. That can happen at any time. So, that's why we keep moving.
How do you handle a kind of a complex situation? For example, if you're faced with scoliosis and a tremor disorder that causes loss of balance.
Yeah, and that happens very frequently in the clinic. I mean, it's usually not just a simple thing like it hurts just when I raise my arm up. There could be some other issues going on too, and you know, usually other medical professionals are involved. There's some disciplinary approach here, but with physical therapy here, we start very simply. You know, let's see if we can find a limitation that we can work on. You know, so if we try to treat the whole big picture thing, sometimes that can be overwhelming. I think just the idea of starting an exercise program can be a little overwhelming. Like, where do I start? Where do I begin? But if we can identify one thing that we can start with, like, let's work on, you know, setting the shoulders back and strengthening that movement first. And then from there, we can look at, okay, how does it look when I start to raise my arm overhead? And then let's add some weight. So it's just starting with something simple and treating it from there. So we kind of try to triage things and see, you know, what are the most important things first to kind of deal with that for your safety, for your quality of life, and then working from there. So it depends on the person, but that's usually how we would start with something simple as that.
We have time for one last question, if anyone has it. Oh, thanks.
Yeah, I think I, like many people, am worried about cognitive decline. And one thing I've noticed by doing balance exercises, not the kind where you stand on one leg, but where you throw yourself off balance on a Bosu ball or a balance board. Could you talk about the value of that for improving your cognition, or at least retaining it?
So I'll talk a few things about that. That's growing edge of research with how exercise, and whether it be balance, something basically challenging for our bodies and for our mind. And you know, they talk about, you know, when you exercise, when you move, that's improving blood flow. And if you're using your brain at the same time, whether it's with a balanced situation or with some kind of cognitive task, like maybe you're solving a puzzle at the same time, that's going to improve blood flow to the brain, and that can improve with cognition. But I would say with balance here, it's all about challenging our bodies just a little bit more to get ourselves out of that comfort zone, so that we can improve. And but with balance things here, that's something that we want to make sure that safety is kind of at the forefront of how we challenge our balance. So yeah, we want to challenge it just enough, but not to the point where we fall, because that's what we're trying to prevent here. So yeah, so it's just like pushing it just a little bit more so that we get that response from the body here. So whether that's, you know, if you're a little bit more athletic or a little bit more mobile, then you can stand on a Bosu ball, which is like this half ball that you can stand on to kind of challenge your balance. But for some of us, that might look like just standing at the counter and balancing on one leg with our hands nearby to catch us if we need to. That could look like just sitting at the edge of a chair, nice and upright here, if our balance is a little bit more, and holding it for 30 seconds. It could look like us doing that with our eyes closed, because our eyes kind of contribute to the balance, to those balance kind of capabilities as well. So yeah, just challenging ourselves a little bit more here, and in a safe way to progress and improve the way that we move.
One last question.
I'm 89 years old. I have been using a cane for a couple of years to help me to balance. Is it unusual or is it normal?
So using an assistive device or using help like that, you know, sometimes it's a safety issue where, you know, you might need to I'm not sure your situation, but sometimes we need that for help. But if we rely on external things like a cane or a walker or a brace, then we start to kind of have to use it after a while, because if you're using a cane, it helps you with your balance, but it's not going to make your ability to balance without any help any better. So maybe we need to use that cane while you're out and about for safety, but when you're practicing the exercise, maybe in your situation, we need to get rid of that cane, but make sure you're safe as well. So using a counter to balance where we don't use the counter at times, and when we need it, it's there. So all that's to say is, you know, the cane is there for safety reasons, but we don't want to start to rely on these things here, because, you know, using a cane might be a little easier, using a walker might be even easier. using a wheelchair can be a lot easier than all those things, but if we start to rely on those things, our bodies aren't going to be as independent as we like here. So my recommendation for you would be, maybe that's something that you can talk to your doctor about, and physical therapists can help you to progress you to the ability, to the point where you don't need to use a cane anymore. So, but we got to make sure that you're safe. So, oftentimes I'll tell a patient, if they feel like balance is an issue, to carry a cane with them and use it as needed here, because carrying a cane, lets people around you know that maybe, you might have some issues with balance, so they might keep their distance, and you can use it as needed if you get tired and whatnot here. So,
Thank you.
Yeah, you're welcome.
Thank you very much, Dexter. Please give Dexter applause. I can just say, as geriatricians, we really rely on physical therapy a lot. And I'm very quick to refer to physical therapy because I've found it helps patients so very much. So thank you again, Dexter.